If you have a lazy eye, weaker eye, or if you've had amblyopia since childhood, and now many years later you're getting ready for cataract surgery as an older adult, well, this video was made for you. In today's video, we're going to cover what amblyopia is, how common it is, and ultimately, if you have amblyopia or a lazy eye, what you need to know when you're getting ready for cataract surgery. Now, real quick, before we get into it, my name is Brad Sifrig. I'm a board-certified cataract surgeon, and this is Cataract Companion, the patient guide to cataract surgery success. If you or a loved one are getting ready for cataract surgery, then you're in the right place. This channel is dedicated to helping patients better understand the cataract surgery process to get your best result. As always, I have no financial disclosures, and Cataract Companion doesn't make sponsored videos, so you know you're getting unbiased information. All right, so let's jump into it. Amblyopia is diminished or decreased vision that occurs during the years of visual development due to an abnormal visual stimulation or abnormal binocular function. That sentence is kind of a handful. Let's rephrase it a little bit. Amblyopia is permanent vision loss that occurs during the years where your vision is developing, typically from around birth to 7 to 10 years old, when the brain doesn't get a good enough visual signal from one or both eyes to develop its full potential. Essentially, because there's some pathology or some limitation of the eye that limits the vision at such a young age, the brain never develops the ability to see 20/20. This is always going to be secondary to some other problem or pathology. Most commonly, it may be a very high glasses prescription at a young age, an unequal glasses prescription between the two eyes, or even a misalignment of the eyes. With amblyopia, if it's not treated or addressed by age 7 to 10, even if the other pathology that caused it is fixed down the road, the brain no longer has the ability to develop that 20/20 vision. Now, amblyopia has a few other common names, and the most common by far is a lazy eye or weak eye. Sometimes lazy eye is also used in the context of a deviated or wandering eye. Medically, we have a different name for that. It's called strabismus. So strabismus is when the eyes aren't aligned. Amblyopia is when one or both of the eyes have decreased vision. Amblyopia overall is actually fairly common in the general population, and most studies show that amblyopia affects 1 to 3% of the general adult population. Unilateral amblyopia, meaning amblyopia in one eye where you have one good eye and one weaker eye, is about 10 times as common as bilateral amblyopia. And really the majority of this video is going to focus on that more common scenario where you have one well-seeing eye and one eye that's always been weaker since you were a kid. As far as the visual signs and symptoms of amblyopia, well, it's not overly complicated. You just have one eye that's always been weaker no matter what, even with glasses. Most patients, by the time you get to cataract surgery, are well aware that you have this weaker or lazy eye and you've had it since childhood. Now, the treatment for amblyopia has to occur in the first 7 to 10 years of life. Oftentimes it involves putting glasses on from a very young age, patching of the stronger eye to encourage the weaker eye to develop. Sometimes it may even involve a surgery to either help clear the vision in an eye or to help align the eyes if they're not properly aligned. As I said, usually by the time you're an older adult, you know if you've had a weaker eye your whole life. That being said, a lot of times your cataract surgeon doesn't know that you have a weaker eye, and it's something that's really important to highlight and to point out to them. When I'm looking on my exam, maybe the only thing I see is a cataract, and I'm attributing that decreased vision just to the cataract, but I may not know unless they tell me that no, that eye's actually never seen 20/20. So that's my first tip in this video, is make sure if you have amblyopia or you have a weaker eye that you tell your surgeon about that. Don't assume that they'll know, because it's not always possible for us to tell just by looking at the eye. Beyond that, if you're a really sharp or astute patient, you'll even tell your surgeon what the best vision you've ever had in that weaker eye is. A lot of patients, particularly ones that are more invested in their healthcare, will be able to tell me, no, this eye never saw 20/20, but it used to be something like 20/40 in my glasses. Again, that's super helpful to know, because it lets me as a surgeon kind of paint a realistic picture and set realistic expectations for how things may be after the cataract surgery. So shifting to cataract surgery, what can you expect after cataract surgery in your eye with amblyopia? Well, cataract surgery typically is not going to significantly increase your vision in that eye, but it can get you back to that baseline level. But you shouldn't expect it to get the eye to 20/20 if it's never been able to do that. It can reverse the changes that have happened due to the cataract, but it can't increase the visual potential of the eye. Amblyopia can really vary from being pretty mild, where the weaker eye is only a little bit weaker than the good eye, or some patients will have one eye that really doesn't see at all or would be considered legally blind if that was their only eye. Some decisions during cataract surgery depend on whether you have a very mild amblyopia or if you have a very severe amblyopia with one eye that doesn't see much at all. So with amblyopia, just like any time a patient only has one eye, there's always some extra considerations for cataract surgery. And one of the biggest questions is, when is the right time to do the surgery? Some patients take the approach of wanting to wait longer to have surgery because they don't want to take a risk with their good eye. Other patients will have surgery earlier because when the cataract starts to affect their vision in the good eye, it really decreases their ability to function in their everyday life. There's really no perfect answer here. It's about balancing risks and benefits, and that's going to be a little bit different for every patient. My personal preference is to lean towards operating a little bit earlier. There's a point with cataract surgery where if we continue to delay, it can make the surgery a little more difficult or a little more high risk. And I don't like to let my patients with one eye get to that point where now the surgery has some additional risk. I think the most important thing with timing surgery, if you have amblyopia, is to involve an ophthalmologist or a cataract surgeon in your care early on. Your average busy cataract surgeon will do hundreds, if not thousands, of cataract surgeries every year. Because of that, we have a really good sense by looking in the office where that cataract is at, and whether it's kind of in that sweet spot to do surgery where there's going to be benefit to your vision, but we haven't waited so long that the surgery becomes more high risk. Since you made it this far in the video, let me know your thoughts in the comments below. If you have amblyopia and you've already had cataract surgery, did you do it a little bit earlier because you noticed the effects on your vision, or did you wait longer because of the hesitation with only having one eye? Other patients would definitely be interested to know what your experience was like. One final consideration with cataract surgery in patients who have amblyopia is what lens choice they should use. If you're not aware, there's a lot of different options for what lens we use during cataract surgery nowadays, and really what lens you pick is going to determine how your vision is from that point forward for the rest of your life. Now, if you want to learn a little bit more about some of those lens options, I've actually made a video that you can check out above that goes through the different categories of lenses and what effect they have on vision. I've also made a digital lens guide that you can download for free by scrolling down to the video description below. For patients with amblyopia, the lens choice for the weaker eye, or the amblyopic eye, is actually pretty easy. I almost always recommend a single range monofocal lens targeting distance vision in that eye. These monofocal lenses focus all of the light to one zone of vision, and therefore they provide the best contrast sensitivity and the best quality of vision. Because an amblyopic eye typically already has some reduction in vision and contrast, you don't want to increase that by using a lens that does more of the same. That's the reason why I don't recommend using an extended range lens like an EDOF lens or a multifocal lens in a weaker amblyopic eye. I do, however, still recommend correcting astigmatism with something like a laser, or with manual LRIs, or with a toric lens if needed, because generally correcting astigmatism during surgery makes it so you won't need glasses as much after surgery, and even can make those glasses a little bit easier to use. Now, the separate question is, if you have amblyopia, what lens should you choose for your better seeing eye, or the eye that doesn't have amblyopia? This conversation is a lot more nuanced and is going to be different for every patient, and something you should really discuss with your surgeon. Oftentimes, I'll still recommend that single range monofocal lens, getting the distance vision into good focus. That keeps the eyes in balance and lets the eyes work together. Now, if you have more mild amblyopia, I also think it's totally reasonable to look into a monofocal plus lens or an extended depth of focus lens to try to get slightly more range of vision. This will make it so you get a little more intermediate vision for things like looking at your dashboard or using the computer, but you'll still expect to need reading glasses for small print and for work up close. For patients with amblyopia in one eye, I typically don't recommend a multifocal lens, even in the better seeing eye. Because you only have one eye that has that full visual potential, you don't want the decreased quality of vision, the decreased contrast, or the nighttime side effects that come from multifocal lenses in that better seeing eye. Because you depend on that better seeing eye so much, you don't want to compromise the vision. One final point to mention is that if you have moderate or severe amblyopia where your weaker eye really doesn't see much at all, then you always want to be cautious with your eyes and protecting them. For most patients, this means wearing polycarbonate glasses over the eyes, and certainly wearing safety glasses anytime you're doing a high-risk activity like yard work, housework, or athletics. So thank you so much for watching this video, and I hope it was helpful for you on your journey to better vision. If you or a loved one are getting ready for cataract surgery, make sure to subscribe to the channel for more helpful videos in the future. Thanks again. I'll see you in the next video.